If you're a parent, you most likely have had that moment where your kid comes into you in the middle of the night, crying that their ear hurts. It's a hard and sometimes scary experience. Or maybe it's happened to you. So should you run right away to the ER or not? Do you even need to be seen? And if so, where's the best place to go? We'll help you answer these questions and more, coming up. Welcome to Family Med, your medical home for practical and accurate information to help your family make healthy decisions. I'm Dr. Earache Richardson, and my passion is helping you cut through all the health information clutter on the internet. If that sounds like the kind of information you or your family needs, make sure you follow along with us. Hit that subscribe button right now and share it with your friends. So, today we're going to talk a little bit about ear infections. You may have seen my prior video on this, but I thought it was a little bit long, maybe a little bit boring, so hopefully this attempt at it will be a little more engaging. Because in this video we're going to focus on how do you recognize them, when do you need to be seen, and where is it most appropriate to go if you have one. My next video will talk a little bit more about home treatments and prevention, so make sure you check out that one as well. So when we talk about ear infections, it's important to know that there are several areas that can get infected. You have the outer ear canal, the inner ear, or the most common that we're going to be talking about today, the middle ear. The official term for this is otitis media. Now in children we tend to see symptoms such as ear pain, especially when lying down, tugging or pulling at an ear, difficulty sleeping, crying more than usual, acting more irritable than usual, difficulty hearing or responding to sounds, loss of balance, fever, drainage of fluid from the ear, headache, or maybe even loss of appetite. Now in adults, common signs and symptoms, they are ear pain, drainage or fluid from the ear, or sometimes even diminished hearing. Now ear infections tend to happen more after recent viral illnesses due to the swelling that happens in the middle ear, creating fluid areas that are primed for infections to grow. So when should you seek care? The answer to this is going to be fairly vague but simple. And it really depends on the severity of symptoms as well as the age of who is suffering through it. So for kids, if your child is less than 6 months old and starts with fevers and pulling at their ears, they really should be seen. The risk of them getting sicker is higher, and it's more likely to be a condition that needs an antibiotic to treat. Over the age of 6 months, it's going to depend a lot on the severity of the symptoms. If they're having significant pain or fevers that you can't control with normal doses of ibuprofen or Tylenol, then they should also probably be seen. Or if their symptoms are lasting over 48 hours without improvement, then it's probably a good idea to go in. Now if you're an adult, it's usually okay if you can control the symptoms at home to give it a few days before seeking care. But if symptoms are persisting or get worse over 2 or 3 days, then it's probably have time to have someone come look at it. All of these symptoms, though, are all ones that you can typically be seen at your doctor's office or quick care or urgent care locations. So save yourself some time and money and avoid the ER if at all possible. Now if you're unsure about where it is appropriate to go, call your doctor's office. They usually have somebody on call that can help direct you to where it's most appropriate. So hopefully this helps you feel a little more comfortable about when you should go in and be seen. In the absence of severe symptoms, you have time to work on some home treatments and see if you can get better on its own. It's important to remember that most ear infections start out being viral and can be cleared on their own. Most of the time your body is going to do what it does best, and that's fight it off on its own. So that's it. If you missed anything, go back and watch it, or check out the notes section below for a review of what we talked about today. I hope you found this information to be useful today. If you did, don't forget to like, subscribe, and even hit that notification button as well as share it with your friends. This really is key for me being able to help continue to produce this kind of content for you. But remember, my purpose in sharing this information for you is to educate you in things that you can think about in trying to make decisions for your own health. In no way should it be taken as direct medical advice to you in your own situation. So please consult your own doctor for concerns regarding your specific situation. So until next time, this is Family Med with Dr. Richardson. Remember, don't forget to take care of your body because it's the only one you have.